Hello everyone, welcome to 10th video of NEET-PG recall question discussion. What is the best parameter for assessing health status of community or best predictor of utilization of health services? It is infant mortality rate. So infant mortality is the best parameter for assessing health status of community or utilization of health services. Coming to question number 92. A child in class 5 in an urban school will receive which vaccine under school health service? So under school health service, child in class 5 will receive TD vaccine, not DPT or typhoid. It is TD vaccine. Coming to question number 93. Farmer by profession presented with progressive spastic paraparesis, great instability and human sign. So farmer with some neurological features, which is the toxin responsible. So this is classical example of neurolathyrism. So this is neurolathyrism, which is actually caused by BOAA, beta oxalyl aminoalanin, and the adulterant in Kesharidal, Lathyrus sativus. So other important food adulteration disease, epidemic dropsy, endemic ascites. These are also important for future competitive exam like sanguinarine causing epidemic dropsy, adulterant in Argemone mexicana oil, endemic ascites caused by pyrrolizidine alkaloids in Crotalaria seeds. So presented with ascites jaundice. So neurolathyrism, epidemic dropsy, endemic ascites, and aflatoxin causes HCC, hepatocellular carcinoma. So these are the important questions for upcoming exam. But for this question, neurolathyrism, this is features of neurolathyrism. So neurolathyrism is caused by BOAA, beta oxalyl aminoalanin. Coming to question number 94, diagnosis, direct image based question. This is Silhouette sign. You can see the opacification here in this area of right side of the lung. So this is right middle lobe consolidation. Silhouette sign, right middle lobe consolidation, RML, right middle lobe consolidation or pneumonia. Opacification of right middle lobe. Direct question from radiology. Coming to question number 95. Person with low BP in childhood tend to have low BP in adulthood also. This is known as tracking of blood pressure or tracking of BP. See the graph here. Those who have lower BP in childhood also lower BP in adult. So this is age and this is blood pressure. This is blood pressure. Those who have lower BP in childhood and those who have higher BP in childhood also have higher BP in adulthood. So this is called tracking of BP. So direct question, tracking of BP. Individual with high BP initially continue the same track in adult. A low BP initially continue to have low BP in adulthood. This is tracking of BP. Coming to question number 96, lateral part of dorsal column injury at cervical region. What will happen? Proprioception loss at ipsilateral arm. As all of you know, proprioceptive tracts passes through the ipsilateral side, and so this will cause at the injury cervical region. So it will cause proprioception loss at ipsilateral arm. This is a modified question from Brown-Sequard syndrome. So in near future exam, you can expect question directly from Brown-Sequard syndrome. Ipsilateral loss of proprioception vibration and contralateral loss of pain temperature because of hemitranslation of the spinal cord. This is Brown-Sequard syndrome. So this is modified question of Brown-Sequard syndrome. So now question number 97, a patient with fever for 5 days, platelet is very less, 20,000, WBC also less, suggestive of some viral pathology like lymphopenia, bleeding petechi, BT increased because of decreased platelet, APTT normal. So above findings are corroborated with which disease? Yes, it is definitely dengue. In case of dengue, you will find fever with thrombocytopenia, bleeding manifestation can be there that can cause increased BT, but APTT is normal because it is not coagulopathy, rather platelet disorder. So typhoid is wrong option, scab typhus is wrong option, malaria wrong. So the answer is dengue. Coming to question number 98, village people consuming a crop as a staple diet. Many villagers are now presenting with paraparesis and using stick to stand. Again another question from neurolathyrism. This is again question from neurolathyrism because of consumption of Kesharidal or Kesaridal. So the ingredients that causing neuroleptin, BOA, pyroxylin. So already mentioned BOA. So which vitamin would help to reduce this presentation? The answer will be vitamin C. See the intervention that can be done to reduce the incidence of neuroatherism. One is vitamin C prophylaxis, so this is the answer, vitamin C. Another is banning the crops, removal of toxin either by parboiling method or steeping method, health education to the community, and low toxin strain production, socio-economic improvement. So these are the intervention that can be done to reduce the incidence of neuroatherism, and vitamin that helps, that is vitamin C. Coming to question number 5, which of the following is not an indication for the following device? This device is tracheostomy tube. This device is tracheostomy tube. So what are the indication? The question is not an indication. The question is not an indication. For pulmonary toilet, yes, pulmonary toileting can be done by tracheostomy tube. Acute upper respiratory obstruction, yes, in case of acute upper respiratory infection, tracheostomy is done. Prolonged mechanical ventilation can be done. For prolonged mechanical ventilation, tracheostomy is also used. Upper airway assessment, no, upper airway assessment is not possible with tracheostomy tube. So the answer is upper airway assessment. This is not an indication of tracheostomy tube. Question number 100. So 5-year-old boy bleeding per rectum, rectal polyp showing coloning epithelium hyperplasia with mucin. The pathology is example of juvenile polyp. This polyposis is example of hamartoma or hamartomatous polyp. So this is all about question number 91 to 100. So don't forget to subscribe my channel Dr. Shankar Dey for more NEET related videos. Thank you very much for watching.